So you've been peeing quite frequently, especially at nighttime, and you're worried that you might have prostate cancer. But before you consider prostate cancer as a possible cause, why not think about other causes? So other causes to think about, apart from prostate cancer, could be you could have an enlarged prostate. So an enlarged prostate, is what we call a benign prostatic hypertrophy, BPH. That can also cause symptoms where you pee at night quite frequently, but you notice that you're passing smaller amounts of urine, or you might notice hesitancy where you're not passing as much urine as you would like. You might also notice poor stream as well, where the urine does not flow as much as it used to. These are signs that this might be benign prostatic hypertrophy. Also, if you're going to see the doctor and examine your prostate, they might notice that your prostate is enlarged and smooth. Whereas with prostate cancer, it tends to be more, irregularly shaped when your doctor examines your prostate via what we call a digital rectal examination. So another cause of peeing at night more frequently could be your lifestyle. Are you drinking too much fluids or water, especially just before you go to bed, or throughout different times of the day? Are you taking caffeine, drinks like coffee? Are you drinking, alcohol? These are drinks that will stimulate your bladder to make you want to pass more urine. Also, are you on medication like furosemide, for example? Furosemide is a diuretic, used for people with swollen ankles or high blood pressure that can also make you pass urine more frequently than usual. So that's another thing to consider. Also, especially in young men might have what we call an overactive bladder, where basically your brain is not really getting the signals that your bladder is not completely full. So you're peeing more frequently than usual because your brain thinks that your bladder is full. And another condition to consider with peeing at night is diabetes. Diabetes, especially, type 1 or type 2, have symptoms of, increased thirst at night. So you're drinking more, peeing at night more frequently, feeling quite tired. So these are symptoms of diabetes to consider as a possible cause of peeing at night more frequently.